Welcome to another Ultrasound of the Week. I am Dr. Michael Schick. Thank you, Aaron Danielson and Sarah Medeiros, for this ultrasound we're about to see. It is a typical night shift. There is a 911 trauma code called above for a GSW, that's gunshot wound to the chest, that has an ETA of 1 minute. You do not have much time to prepare as this young male arrives. You find him to be tachycardic, hypotensive, and have an altered mental status. You immediately see that there is a gunshot wound to the chest and right abdomen. You do a quick secondary exam and do not find any other wounds. So you call for blood, you order some IVs to be placed with some saline boluses, and you await your surgeons to arrive. You're thinking about airway management as well, but you'd like to get some volume, some blood on board before you go that route. And you also know the best thing you can do for this patient is identify a critical, life-threatening diagnosis now. So you grab the ultrasound machine. Immediately upon placing the probe in the parasternal long axis, you identify a large pericardial effusion. There's a little bit of heart swinging, but the most important thing about this clip is that you see that telltale sign of tamponade on echocardiography, which is right ventricular collapse during diastole. And here's the big tip of the week. If you're not sure whether that RV is collapsing during systole or diastole, hit the freeze button on the machine and then use the tracking ball to just back up in time a few seconds. Watch that LV for filling. When the LV is at its largest dilation, when it's filling, look at the free RV wall. If that RV is collapsing during that filling cycle, you know there's tamponade. In fact, that's exactly what we see here. If we take still images of this clip, we can see that when that heart is at its fullest, the left ventricle, that free wall of the RV is collapsed. But when the LV is contracting during systole, and there's no volume in there, that RV is actually larger than it should be. That RV should actually be contracting, but it expands instead. Clip 2 re-demonstrates those same findings. In clip 3, an apical 4 chamber is being attempted. We don't see all 4 chambers. We can see a large pericardial effusion, which is helpful. And if you do see all 4 chambers, especially the left ventricle and right ventricle, you can look for a McConnell sign. That's when the apex of the right ventricle bows in and out during systole and diastole. It looks like a little guy jumping on a trampoline right into the apex of the right ventricle, and that can be a sign for elevated right heart pressures or tamponade. In clip 4, we again demonstrate a parasternal long view with right ventricular collapse during diastole. And then clip 5 is an important clip. So we're looking at the IVC, and we're in cardiac mode, so the image may be flipped from what you traditionally are familiar looking at. But you can see the IVC in long axis, and it's large. It doesn't move at all with respiratory variation, so it's very plethoric. And this is an important finding in any condition that creates an obstructive shock pattern. So in tamponade, you have obstructive shock because the RV is being collapsed. Blood cannot get through the RV, cannot get through the right atrium either, and therefore backs up into the inferior vena cava. If you look at the inferior vena cava and you're concerned about tamponade, but you see a lot of respiratory variation, then tamponade is basically taken off your list. It should no longer really be in the differential because you're going to have a huge amount of backflow into that IVC. Lastly, sometimes you can see right atrial collapse before right ventricular collapse because the right atrium has smaller or thinner muscle than the right ventricle. You'll see this best in the subxiphoid view, apical 4 chamber. Sometimes you can see it in a IVC view as well, basically a subxiphoid view. Don't forget your other parts of your EFAST exam. You want to make sure that it doesn't have a pneumothorax as well. Worthwhile to look for free fluid in the belly, but remember this is a penetrating wound and he needs advanced imaging or surgical exploration.